medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Pretty much every day in practice, I, and I'm sure you do as well, have to make a decision on whether a particular blood test is going to be clinically relevant at the end of the day. One of the ones that I'm often faced with and I talk to students about is the use of vitamin assays, and particularly the water-soluble vitamin assays. We already know that things like B12, because there's a reservoir in the liver, and folic acid give us some information. Certainly, we know the fat-soluble vitamins like A, D, E, and K may have some good reason to be monitored. We always ask for a vitamin D level, and we can do a vitamin A, etc., etc. As the fat-soluble vitamins, they are very helpful. But my question is it worth it clinically to assay for B1, B2, for example, B6, paraminobenzoic acid, things of this nature in the B family, and vitamin C? A problem is, once you take a vitamin within 32 minutes to an hour, whether it's vitamin C or the water-soluble B vitamins, they're typically already half-life gone, which means their life is very short. Now, the physiological properties and what it does last sometimes for up to 3 weeks, as in the case of, for example, intravenous vitamin C. But actual assaying for it's going to show that that level's probably low. So for me, getting like B1, B2, B6 levels type of thing, I don't normally do. I will look at folic acid and B12 regularly because of the storage that I mentioned earlier, and it does give a hint to some neurological issues and other diseases that may be prone to stomach and intestine, especially in pregnant women as well. But as far as getting these on a regular basis, I do not personally see the advantage to it. As a matter of fact, the test would hardly be accurate when you think, well, if I take a vitamin now and half-life is only maybe an hour, 30 minutes to an hour, when did I assay it? When patient's not going to remember, you're not going to remember. And what good is that anyway? Because even though there's a certain level, there are certain diseases, as you all know, that require much more of a specific vitamin and more often dosing, regardless of what the specific level may be showing. So using a fat-soluble vitamin type of assay makes a whole bunch of sense. Using water-soluble types of assays, in my opinion, do not make a bunch of sense because of the accuracy. The need for them may be much greater than the actual number that's on the piece of paper. And of course, the timing and the length of time it's in the system are not that great either. So the other thing you should be aware is, for example, if you wanted to measure like thiamine, it's almost hardly ever in the plasma or in the blood itself, circulating blood. It's in the erythrocytes, but particularly in very low levels. That gives you an example. The other thing is, after you take blood from someone, then you're going to send it, for example, to a lab. Let's say it's for a water-soluble vitamin. Well, what do you know about water-soluble vitamins other than, oh yeah, that's right, they're light sensitive. Vitamin C and the B vitamins, the water-soluble, are very light sensitive. So if for some reason they're left out or they're left under artificial lighting or they went in some sort of container that got light on them or the lab leaves them for any length of time, you'll have inaccurate results anyway. So let's do the A, D, E, and K on a regular basis, of course. The minerals are a different story altogether because we're looking at repository forms of them. B12 folic acid, of course, but the typical B vitamins and vitamin C are rarely useful clinically. I'm Mitch Ghen. If you want more information, please go to drmitchghen.com. It's drmitchghen.com. Thanks for watching.